Ever spun around in circles as a kid and then tried to walk in a straight line? Remember that dizzy, disoriented feeling? Now, what if that sensation wasn't just a result of childhood antics, but something that occurred frequently and seemingly out of the blue? Welcome to the world of dizzy spells, a common but often misunderstood health issue. When we talk about dizzy spells, we're diving into a complex system of balance and coordination, primarily controlled by our ears and brains. Yes, that's right, our ears. The inner ear, to be precise, plays a crucial role in maintaining our balance. It contains a structure called the vestibular system, which sends signals to the brain about the body's motion and position. When everything functions correctly, we can move, walk, run, and dance without a hitch. But what happens when something goes wrong? Imagine this: you're walking along a narrow path. Suddenly, the ground beneath you starts to shift. Your brain receives conflicting signals. It's like a faulty GPS. It can't figure out which way is up. This confusion results in the sensation we know as dizziness. Many factors can cause this confusion. It could be as simple as dehydration or as complex as a neurological disorder. It might involve problems with blood circulation or issues with the vestibular system itself. Infections, migraines, certain medications, and even anxiety can all play a role in causing dizzy spells. And then there's vertigo, a condition often mistaken for simple dizziness, but it's much more than that. Vertigo involves a sense of spinning or movement, even when you're perfectly still. This can be a symptom of conditions like Meniere's disease or benign paroxysmal positional vertigo. So how can these dizzy spells be managed or treated? Well, that depends on the cause. If dehydration is the culprit, drinking water and staying hydrated can help. For issues relating to the ear, treatments can range from maneuvers to reposition particles in the inner ear, to medications to physical therapy. In cases of vertigo, specific exercises and maneuvers can be effective. In some instances, medical or surgical intervention may be necessary. In summary, dizzy spells are not as simple as they may appear. They involve a complex interplay between the inner ear and the brain, with numerous potential causes. From dehydration to neurological disorders, the triggers can be varied. Vertigo, a condition often mistaken for dizziness, involves a sensation of movement when there's none. Treatment for dizzy spells depends on the underlying cause and can range from simple hydration to medical intervention. Understanding the science behind dizzy spells can help demystify this common but often misunderstood health issue. That's the scoop on dizzy spells. They might be disorienting and confusing, but with a little knowledge and the right approach, they don't have to throw you off balance. Thanks for tuning in. Remember, knowledge is power, and understanding our bodies is the first step towards better health. Stay curious and keep exploring.